Bismillahirrahmanirrahim. Let's discuss the clinical features of neoplasia. The first one is effects according to tumor location. Tumor can cause morbidity and mortality, so location is very important. Let's take example. For example, a small 1 cm pituitary adenoma may cause the hypopituitarism, while a small carcinoma within the common bile duct, if malignant, it may induce the fatal biliary tract obstruction. Let me further explain it. A 0.5 cm leiomyoma, when stuck into the renal artery, it may even lead to renal ischemia and hypertension. This signifies the effect according to the tumor location. The how much tumor location is important. Hormone production increase in both benign, that is mostly in benign hormone production is increased, and let's suppose in malignant tumor that arise in endocrine glands. For example, tumor of pancreas, that is increased insulin secretion, may lead to hyperinsulinism. Our tumor of adrenal cortex may lead to increase or excessive activity of corticosteroids. Obstruction may be caused in a hollow viscus by tumor in lumen or pressing on the wall from outside. For example, intestinal obstruction or in biliary tract obstruction may lead to obstructive jaundice. In a urinary tract, it may lead to hydronephrosis. In bronchus, it may lead to pulmonary collapse. And in portal vein, it leads to ascites and varices. Irritation of serous membrane is there. It can lead to inflammatory exudates, tissue destruction, that is loss of function, perforation, hemorrhage. Infection is a clinical feature of neoplasia too. Fever is also there. It is due to infection. Anemia is present. It is due to prolonged malnutrition, recurrent blood loss, long-lasting infection producing marrow depression. Cachexia and paraneoplastic syndrome are the important clinical features of neoplasia. Let's talk about paraneoplastic syndrome. These are the symptoms complexes caused by cancer which are not easily defined by local spread of tumor, distant spread of tumor, or elaboration of hormone not indigenous to the tissue from which tumor arises. Means that you can't define these symptoms. According to Robin, it occurs in patients with cancers. Means that in a patient that is suffering from neoplasia, you can't define these symptoms simply by seeing the locus spread of tumor within a patient. Are you supposed to see the distant spread of tumor? No, that won't lead to the clear-cut definition, or you won't not be able to easily define the tumor. There may be early symptoms of occult cancer, or they may cause significant clinical problem. There is also a possibility that they may mimic metastatic disease therapy. Let's discuss the types. Endocrinopathies, nerve and muscle disease, dermatologic disease, osseous articular soft tissue changes, vascular and hematologic changes, are miscellaneous. I hope it is clear now. Let's talk about the clinical symptoms, major form of neoplasia and agents. The first one, we are going to talk about endocrinopathies. First example is Cushing syndrome. Its major form of neoplasia are small cell carcinoma of lung, pancreatic carcinoma, neural tumors, and agent is ACTH. ACTH stands for adrenocorticotrophic hormone. Inappropriate ADH secretion will lead to the small cell carcinoma of lung or intracranial neoplasm, and the agents will be ADH. Hypercalcemia, very important endocrinopathy. It is involved in breast cancer, breast carcinoma, renal carcinoma, ovarian carcinoma, lymphomas, common cell carcinoma of lung. Agents are PTH related proteins, that is parathyroid hormone, or tissue growth factor alpha, or tissue necrosis factor, or interleukin 1. Hypoglycemia, major form of neoplasia will be fibrosarcoma, mesenchymal sarcoma, hepatocellular carcinoma, and the agent will be insulin or insulin-like substance. While in carcinoid syndrome, it is bronchial adenoma, pancreatic carcinoma, agents are serotonin and bradykinin. One thing I would like to tell you, that in carcinoid syndrome, the agents are the serotonin and bradykinin. Over here, the patient will experience the increased flushing and sweating. And polycythemia, that is renal carcinoma or hepatocellular carcinoma, agent is erythropoietin. Its common cause is high altitude. Let's discuss the nerve and muscle syndrome. Let me zoom it a bit so that it is clear for you. Okay. Nerve and muscle syndrome, it includes myasthenia and disorder of central nervous system and peripheral nervous system. Myasthenia involves the bronchogenic carcinoma, thymoma, and CNS and PNS disorders includes breast carcinoma, teratoma, both are immunologic. Dermatological disease involve Acanthus nigricans, it causes gastritic carcinoma, lung carcinoma, uterine carcinoma, and dermatomyositis that involve bronchogenic and breast carcinoma, both are immunologic. I would like to explain what do this term Acanthus nigricans means. It means the thickening and discoloration or hyperpigmentation of acanthus squamous. As derived by the name acanthus, acanthus derived by the name that it causes hyperpigmentation of acanthus squamous. It is a folded layer of skin. And dermatomyositis include derma skin, and myositis means muscle. Osseous articular soft tissue changes include the hypertrophic osteoarthropathy and clubbing of fingers. The major form of neoplasia is bronchogenic carcinoma, and agent is unknown. Okay. Let's discuss some other. The fifth one is the vascular and hematologic changes. For example, venous thrombi, that is called Rosser phenomena. It will involve the pancreatic carcinoma, bronchogenic, and other cancers. Agent is tumor product, mucin. Non-bacterial thrombotic endocarditis. It is very important, non-bacterial thrombotic endocarditis. The major form of neoplasia is occurring in bones cancers. Agent is hypercoagulability. And anemia, major form of neoplasia, thymoma, and agent is immunologic. Others include the neoplastic syndrome. Okay, let me explain the neoplastic syndrome. Neoplastic syndrome means that greater than 3 grams per 24 hours albumin is released in urine. Hypercholesterolemia and hypoproteinemia is there. When too much, like you can see that as so much greater than 3 grams per 24 hours albumin is released, so definitely it leads to hypoproteinemia. The major form of neoplasia is various cancers, and agents are tumor antigens immune complexes. Let's discuss cancer cachexia now. It is defined as loss of body fat and lean body mass, that is profound weakness, anorexia, and anemia is seen. Causes are cytokine release, calorie expenditure remains high, basal metabolic rate remains high. Why? Because cytokines are released. A major theory that is put forward to explain the cachexia in cancer is this. Tissue necrosis factor is there that really decreases the appetite, inhibits the lipoprotein lipase. As a result, it inhibits the release of free fatty acids from lipoprotein. Proteolysis inducing factor will cause the breakdown of skeletal muscle protein by ubiquitin, that is the proteasome pathway. As a result, continuous protein breakdown is there, and that will definitely lead to the loss of body fat, or lean body mass, or loss of proteins, leading to weakness, anemia. Molecules with lipolytic action are also present that are continuously breaking down the body fat. Treatment, no satisfactory treatment is there unless and until by simple surgical means you remove that neoplastic organ or tissues from that site. That's all. Love this.